Hi, my name is Ploy and today I will talk about HIV and AIDS. So first, I want to start off by telling you guys the difference between HIV and AIDS. So AIDS is the final step of HIV or human immunodeficiency virus. Next, HIV will attack your immune system, which is white blood cells or T cells to make it weak. And lastly, person with AIDS is those whose immune system cannot fight or too weak to fight off. So I will mainly focus on HIV. Cause of HIV. HIV infection is caused by a microbe named the human immunodeficiency virus. This virus lives in human blood, sexual fluids, and breast milk, so it will attack your immune system. So your body will have a really hard time fighting off the common germ or virus. This is the HIV life cycle. I decided to put a picture because I think it will be easier to understand. So first step is binding. HIV binds to the receptors on the C4D cells. The second step is fusion. HIV envelope and C4D cell membrane allow HIV to go into the C4D cells. On the picture, as the guy can see that HIV is getting into the cell. Third step, reverse transcription. HIV release and use reverse transcription by convert the HIV RNA into the DNA, which allow HIV to enter to the CD4 nucleus. Fourth step is integration. Inside C4D nucleus, HIV release its enzyme and put DNA that infected into the C4D cells. From the from the picture of the fourth step, it will be cells which is red and blue. The blue is not infected and red is infected. So like the you guys can see that the red is trying to be the part of the blue chain. So like it's getting into the not infected part. And the fifth step is replication. HIV begin to make a long chain of its protein. So from the fourth step, which is the red and blue chain, it's small one, and once it's combined, it will begin to make a long chain, which is the green one. The sixth step is assembly, so the new HIV protein and RNA move to where it's not infected. And lastly, budding, so HIV releases its enzyme and creating all chain into the infected cells or the chain. So all the chain in the CD4 nucleus will be all infected by HIV rapidly. History of HIV. There are two people that discovered HIV. So USA and France made independent research about this. In 1983, this French researcher is named Louis Montagnier of the Pasteur Institute in Paris. He discovered HIV, and the next year, which is 1984, they co-discovered HIV from USA named Robert Gallo. From 1984 to today, we know this virus or HIV for almost 35 years now. Knowledge and attitude of HIV. In the past, only educated people know and be aware of it, but and um not well educated people believe that healthy looking person cannot be affected, which is misunderstood and wrong. So like people that have sex don't really protect themselves, which made the rate of HIV increase a lot. People that infected by HIV at that time or in the past will be not accepted in the society and will be disdained. But today, most of people know of HIV and be aware of it. But the rate of people that infected will still increase. But otherwise, HIV is more accepting in the society and people can join in the society normally. Current research of HIV. Scientists produce new vaccine for the first time. This vaccine will induct the human cells to generate the antibodies to HIV. There's two different approaches to curing HIV. So the first one is to combine therapy to purge majority of HIV infected cells and from the body and will reduce the rest. The second one is genetic engineering technique. It will make a C4D cells that immune to the HIV or CD4 cells that display new immune reaction to the HIV. So it's like the new reaction that HIV virus never seen before, and they'll be like shocked about it. And we hope it works. Where is this disease prevalent? According to the graph, as you guys can see, the Southern Africa is the continent that affected the most. And from the record from 2018, um, Switzerland is the country that has the highest rate, which is around 27.3%. And now, number of people that infected by HIV is approximately around 37.9%, which 36.2% is an adult, and the rest is children. The most gender that affected is men, and men around 50 years old. The new infection rate is around 1.7 million people from 280. HIV transmission. It can transmission in many ways, from mother to childbirth or breastfeeding, from have a sex with someone who does not use condom or has HIV, from sharing needles or syringes with someone who has HIV, and can be affected by use the needle or cut the things with like knife that have the blood of people that affected by HIV on it. So it will be like affected because you touch the blood and like you get that blood into your body. HIV is congenital disease. It happened because mother infected by HIV and the mother gives birth to the baby, but it can lead to the acquired immunodeficiency syndrome of AIDS. It's like you was born and then when you grow up you get it by yourself, not since you was born. Pathology. Where in the body does HIV affect the tissues? The brain tissue thinnings of the brain tissues by 10 to 15% compared to the normal rate. The lymphoid tissues can cause the neurological complication tissues, and it can damage muscle tissues, which will with that will make that muscle stop repairing itself, and the body loses its ability to hormonally regulate itself, and can lead to loss of cell. HIV found a white blood cell called CD4 cells, and HIV will get inside of CD4 cells and will copy itself and kill the good cells. Organelle. It happened because mitochondria damaged by the HIV treatment or the treatment that you use to like protect yourself from HIV. How HIV damages the body. The immune system cannot fight off the disease and infection. Virus infect cells and use to make more virus. Major sign. In a few weeks, you will have a flu-like symptoms or cellular conversion illness. For example, skin rash, fever, sore throat, headache, and can also chapped lips. But make sure you test first because you will know for sure that you're infected or not. Sequence of disease, acute HIV infection. This is the earliest stage of HIV. It will develop within 2 or 4 weeks. This stage, HIV will multiply itself really fast and can spread throughout the body. The virus will attack and destroy the CD4 cells from your immune system. During this stage, the level of HIV in blood will be really high, and it will be increase the risk of HIV transmission. The second step is chronic HIV infection. The second stage, um, during this stage, HIV will continue multiply itself, but in the very low levels. HIV will usually advance to AIDS within 10 years, and the final step is AIDS. So this stage start because of your body cannot fight off the HIV anymore, and once the person diagnosed by AIDS, they can spread HIV to the person not infected or person other person very easy. Without treatment, people can live with it around only 3 years. Response treatment activities of our immune system against the pathogen. Once HIV enters the body, the immune system initiates anti-HIV antibodies and cytotoxic T cell production. However, lots of time for people infected to HIV, the body will make the good amount of antibody to fight off HIV. Treatment of HIV. Antiretroviral drug or drug that used to treat yourself or make yourself better from HIV. This drug will stop the virus replicating in the body and allow immune system to repair itself, prevent future damage. However, treatment may affect you by difficulty sleeping, vomit, headache, dry mouth, and chapped lips. This is other resources. Thank you.